Governor Lamont says Connecticut continues to lead in the race to get as many individuals vaccinated as quickly as possible. Connecticut actually ranking third nationally in terms of vaccinations, but there is still much work to be done. Connecticut is expecting to see a 16% increase in vaccine doses beginning next week, meaning the usual 46,000 weekly supply would jump to about 54,000. So far, the state has administered more than 360,000 vaccine doses, but has the capacity to do more. With the new increase, Governor Lamont says the state plans to target those ages 75 and older in underserved communities.
In terms of those socially vulnerable communities, those communities where folks, maybe they're living in multi-generational housing, densest communities, black and brown folks, those that can't telecommute, going to work every day, those most at risk that impacts their health, their personal health, as well as the community health, because you've seen the possibilities of flare-up. We've only 23.5% of them have gotten their first dose.
Only about 23% of those ages 75 and older who fall into the underserved community category have received their vaccines, compared to 35% of individuals who do not come from an underserved community.
There still is some distrust in our community around the vaccine.
Reverend and Hartford community activist A.J. Johnson says these communities have a dire need for the vaccine, considering black and brown individuals have been disproportionately affected by the COVID-19 virus. But knowledge behind the vaccine needs to come from trusted sources.
I'm personally telling friends and family to take it because, you know, this is a deadly virus. We've got to protect our loved ones. But I know with me saying that, there's still people that's going to feel differently about it.
This week, a virtual town hall was held between Bristol Health and its local NAACP chapter in hopes to dispel vaccine rumors and instill trust within the community.
The partnership between Bristol Health and the NAACP, it ensures a trust between the community and organizations like Bristol Health and, of course, that community that they serve.
The state plans on improving access to vaccines as well.
As we begin to finish up our nursing homes, obviously in our hospitals, we're going to make the vaccine more readily available, at those mass distribution facilities and centers, and our retail locations.
80 workers have been added to the state's vaccine hotline, and according to Lamont, the wait time is now down to 3 minutes. The governor says they are also rolling out senior housing mobile clinics, congregate facility clinics, and there's the addition of 14 Walgreens and CVS vaccine sites throughout the state. And Governor Lamont says the state should finish up vaccinating those individuals ages 75 and older in just a couple of weeks, and then they will move on to vaccinating those ages 65 and older. At the state capitol in Hartford, Nia Maldonado, Fox 61 News.